News Talk 760 WJR presents Living Pain Free with host Warren Pierce and special guest Jeff Morton. For WJR, here's Warren.
All right, Mark, thanks a lot. Welcome into a beautiful Tuesday evening, and as usual, doing our best to make sure that you are on top of the problems that you're experiencing when it comes to pain. That's the subject we're going to discuss for the next, 54 minutes or so, and certainly it's something that each and every one of you can relate to as we look at the number one, listen to this now, folks, and if you have pain, you don't need me to tell you this, but pain's the number one reason why Americans look for health care, and more Americans suffer from pain. And I've pointed this out before, but it's always so sobering and shocking statistic. But there are more Americans that suffer from pain than from diabetes, heart disease, and cancer combined. And in addition to chronic pain, you've got pain lasting more than 12 weeks. Think about this. It can lead to a lot of other health problems, including a sleep deprivation, limited movement, and depression. And chronic pain can also take longer to eliminate and possibly require more diagnostic steps and treatment and different approaches as well. And it not only limits your mobility, but also the quality of life. People who are looking to relieve pain try all sorts of procedures. And again, those of you who are directly affected or someone in your family, a work colleague, you know about this, injections or surgeries and drugs, things like that, which brings us to our guest, the director of the Pain-Free Life Centers of Michigan. They're out there in Troy. Jeff Morton is back with us. We like to get together and talk about the laser and the impact it's had initially, Jeff, on animals when vets were using them 30 years ago. And then sports trainers took a look and said, well, look, if it works on horses or dogs or other animals, and you've had that experience, maybe it can work on our athletes too. And it got into the training rooms. And then it really expanded from there. 30 years, and you've got the latest equipment to be used on those who are looking to eliminate or reduce pain. But tell our listeners, again, for those who haven't heard about what lasers can do, how the laser goes about rejuvenating the areas of pain, no matter where they are, from head to toe and everywhere in between.
Right, Warren. First of all, it's a scientific fact that human cells respond to light. There are 714 different frequencies of light that can be combined to make laser diodes that do all kinds of things. What we use at Pain-Free Life Centers is high-dose laser therapy. We're the only high-dose laser therapy center in Michigan. We have the most experience of any laser center in Michigan, probably one of the top 5 laser centers for pain in the country. So what the laser does is the laser will penetrate below the skin to the cellular level, and it will...
But it's not invasive.
Right, totally non-invasive.
Right.
We don't even touch the skin, as you know.
Yeah,
right?
Exactly.
So the light will travel through the skin to the damaged cell, and it gives the cell the ability to produce energy that's called adenosine triphosphate, or ATP. That's the body's natural energy source that it needs in order for an unhealthy cell to rejuvenate itself and get healthy. When this happens, it creates vasodilation, which is the increase of blood flow, and the body will release nitric oxide, which is the body's natural enzyme to reduce inflammation. So you have unhealthy cells getting the energy they need to get healthy, creating increased blood flow, reducing the inflammation, which allows the body to heal. That whole process is your favorite word, photobiomodulation.
Right.
But it's really, science has named laser therapy in the process in the body correctly, because if you break down photobiomodulation, photo is light, bio is life, and modulation is change. Our bodies are made up of light, energy, and water, and it's science. So it's tried and true. And I brought a guest tonight that we'll get to later that is an amazing story, and the listeners really will like him. And that's how the laser works. So 95% of the pain in our body is caused by some sort of inflammatory condition, anything that ends in the suffix itis. Arthritis, bursitis, tendinitis, plantar fasciitis, And what happens is we reduce the inflammation, allow the body to heal, and the pain goes away.
Yeah, in sports injuries, as I suggested, one of the early uses of the laser was to repair those athletes who are so skilled and depend, of course, on their bodies to provide a living for them. So trainers said, hey, if it's working on horses, working on dogs, maybe we can use this to eliminate or reduce pain in, you work with athletes.
We do work with athletes, Warren. And, the biggest story for the laser therapy world was Jared Allen from the Carolina Panthers before the Super Bowl. He had a broken fifth metatarsal in his foot. And
he had an ankle injury, right? You'd think you'd break your ankle 2 weeks before the Super Bowl game. Right. There's no way you're going to be able to play.
Nope, and he did. He did, unfortunately on the losing side, but he did play. So, it's amazing. But, we treat everyday people. The athletes is great, and it gives us credibility. But really our people, and they come from as far as Napoleon, Ohio, and Alpena, Michigan, and Kalamazoo and Tecumseh and Windsor and all over, and they're driving 2.5, 3 hours each direction to come see us because what we do works. And so I would say 88% of our patient base is really just people like you and I, regular everyday people like Glenn, who's here in the studio tonight. And, I want to tell the listeners too, there are wellness coordinators standing by right now because we get so busy after these shows.
Yeah, the spots fill up.
They need to call immediately.
Well, and we should point out, too, that you're so sure that your laser, the strongest laser that is being used in certainly the state of Michigan, those spots fill up so quickly that the faster our listeners call and make it, and we'll give them time. Let them hear what you have to say.
Right.
Let them hear what Glenn has to say. Glenn was listening to this show, months ago. He was, and we'll get to his story as you suggest, he was skeptical about the whole thing, but hearing you talk about it, so you all listen. And if you have questions, if you have a particular pain, or someone you know has one, feel free to call directly here to us, 800, it's toll-free, 859-0957. It's 1-800-859-0WJR. Think about what you've been experiencing. Maybe they've told you need surgery. Maybe you're getting some sort of over-the-counter suggestion or a prescription drug. No matter what the problem is for you, maybe you've gone that route and you're still not pain-free or the pain isn't reduced. Safety, is it? Yeah, there's no doubt about it, right?
100% safe. There are no side effects. It's totally non-invasive. It's amazing what we do for people. It's incredible.
FDA has cleared it.
Absolutely. Since 2003, we've been cleared by the FDA. And, high-dose laser is where it's going, and I've seen in the last 18 months the change in equipment. 2 years ago, we were using 15-watt lasers, and at that time, they were the best lasers you could
That was
get.
about the strongest you could get.
It was. Now we have lasers up to 60 watts.
Why is that so important, those numbers, and what do they mean?
Well, the higher the wattage, the deeper the penetration, which is important for back issues. But the most important thing is lasers emit energy measured in joules. It's a measurement of energy. And the higher the wattage, the more joules we can give the patient in a particular period of time. And an average treatment time is 15 minutes. And so what we used to do with 15 watts would take 30 minutes. We can really now do that in 7.5 minutes, but the average time is 15 minutes for a treatment.
And your patients don't necessarily bring in any scans, any X-rays, any MRIs. They pretty much point to where the pain is. Maybe it's a migraine. Maybe it's something in the ankle or the foot or plantar fasciitis, or as you've suggested, a majority of the folks who come to see you, lower back pain.
Lower back pain is absolutely our number one area that we treat. And neuropathy is the second, probably the most area that we treat. And also arthritis. We see a lot of arthritis in the hips, in the back, in the knee, patella tendonitis. We do a lot with Achilles tendonitis, high ankle sprains, degenerative hip, osteoarthritis. I have a lady that comes from Albion with rheumatoid arthritis. And I got to tell you, Warren, I'm so proud, and I hope this patient is listening. I have a patient came in last week, 102 years old.
Really?
That's
got to be the oldest so far.
97 was the oldest.
Yeah, right, exactly.
Yep, and 102, and actually she's going to be 103 on June 20th. an amazing woman, came in with sciatic nerve pain, lower back pain, and she still lives on her own. She's absolutely, I'm honored to treat her, actually. And it's amazing what we're doing. Her son's 75. Her son brings her in. It's just an amazing story. She's an amazing person.
And you've got very young people coming to use the laser treatment as well to eliminate or reduce the pain they're suffering.
Right. And the FDA cleared OxyContin for children as young as 11.
That's another story.
And so I was invited by Mike Jolly, who used to play for the Green Bay Packers and U of M, to speak with the Michigan High School Athletic Association to all the athletic directors, and we're treating a lot of student athletes, from the ages 13 to 17, trying to keep them off the OxyContin. It's just a slippery slope downward for that, and with the heroin addiction problem that we have going on in this country, it's just going to stimulate that. So that's what we do. So anywhere from 13 to 103, I guess you can say.
All right. So take the number down now. If you have a pain, no matter where it is, if you know someone who does, maybe in your family, maybe some of you work with, how tough it is to get through the day-to-day lives with those who are experiencing pain. You can ring Jeff up at 1-800-859-0WJR, or it's 1-800-859-0957. We'll put you on the line with Jeff. We'll meet one of the folks who have stopped by the location out there in Troy and talk with him too. And before 8 o'clock, we're hoping to, in some way, somehow, reduce or eliminate your pain. Jeff Morton's the director at the Pain Free Life Centers of Michigan. They're out there in Troy. Their phone line is 248-879-1100. Their website, mark this down too, painfreelifecenters.com. And again, they have folks standing by, the wellness coordinators, as we speak, are waiting for you to call. They're going to be around till 8:30. But listen to our patient story who's coming up next, and we'll hear your stories too, and from Jeff as we continue on toward 8 here on this special edition on WJR.
If you'd like to see how laser pain therapy can change your life, call Pain Free Life Centers now to schedule your initial no-cost consultation and free treatment. Wellness coordinators are standing by now to take your call at 248-879-1100. You have nothing to lose but your pain. Once again, that's Pain Free Life Centers at 248-879-1100 or visit painfreelifecenters.com. We'll be right back with Warren Pierce and Jeff Morton, Director of Pain Free Life Centers, on News Talk 760 WJR. It's Great Places at the Great Lakes with Warren Pierce, presented by Pain Free Life Centers of Michigan, located in Troy. Once again, here's Warren.
And don't forget, if you're suffering from any kind of pain, whether it's, an Achilles tendonitis or maybe arthritic pain or knee pain, or you got some bursitis or fibromyalgia, whatever your pain, whatever you're dealing with day in and day out, that's, just making it very difficult for you to go day to day, give us a ring and we'll put you on the line with the chief laserologist at the Pain Free Life Centers. Jeff Morton is here. We've talked with him now for a few years or so about what lasers can do for you to eliminate that pain and how they go about doing that. So it's 1-800-859-0957. Whatever your pain right now, you're listening and you're looking for an alternative to the injections, to the possible surgery. Maybe you've already had it already and it hasn't reduced the pain. You're still suffering day in and day out. You ring us up and we'll put you on the line with Jeff as well at 1-800-859-0957. And you bring a patient and a spouse, I see, to the show this evening.
Yeah, I did, Warren. I've had patients on the show before and doctors. But you know what? Pain isn't just for the patient. It doesn't just affect the patient. So tonight I brought down a patient of mine, Karen, and her husband, Marshall. And it's pretty funny because Marshall is the one that heard us on the radio and was the skeptical one and got his wife to come into Pain Free Life Centers. And they'll be more than happy to share their story. They can talk about it way better than I can.
What was the pain you were going through, Karen? And what had you tried to eliminate?
Well, Warren, I had back pain.
Lower, upper?
Lower back pain.
Right, I can relate to that.
Yes. Bulging disc in L4 and L5. I had a piriformis syndrome, which is a muscle that was pulled, was pressing on my sciatic nerve, which was sending pain down my leg.
Right.
So I could barely walk. I mean, if I stood for more than 15 minutes, I couldn't do. I mean, it was hard.
What had you tried to eliminate that pain, and how long had you been experiencing it?
The real bad pain was probably 5 months, and I had gone through chiropractic.
Any injections, anything like that? Over-the-counter medicine, prescription drugs?
Oh, yeah. I mean, lots of 800 Motrins and anything I could get.
Probably, 4 of those a day at least?
Oh, yeah.
What
Yes,
about,
definitely.
Did anyone tell you, you know what you need here, Karen, is back surgery?
I wasn't going to go there, so I wasn't going to let anybody tell me I needed back surgery.
And Marshall, you're living in the house with your significant other. What kind of impact does something like that have on the family, your family?
Well, it's just a lot of pain, and we were traveling a little bit, and that basically stopped because she was unable to get around and get through the airport and everything. We had a job out in California that didn't work so well. I knew she was going through a lot of pain, and the chiropractor, as good as he could be, it wasn't being successful, and the pain kept getting worse. And I was driving along and heard about blast pain at that point in time, which is now the Pain Free Life Centers, and an ad, I believe, on your radio station.
Sure.
So we made a phone call when I got back home that day, and made an appointment to go over there. And like Jeff had said, I was quite skeptical because I wasn't sure how this worked, and insurance didn't want to take care of it because the FDA isn't on board with a lot of things quite as slow as they act in our famous government there. But we wrote a check to get this thing going, and I'm telling you, it was worth every dime.
Jeff, there's really nothing to lose. First of all, you're taking care of the first appointment, but we'll put that aside. And we've talked a bit about lasers and what they're doing and how yours are different than all the other lasers put together, and how they are rejuvenating the cells and getting rid of the inflammation as well. But it's non-invasive. Explain how the laser works when you go into your office and lie down on the bed there. What takes place?
Well, first, when a patient comes in, Warren, there's a 5-page patient information form that they have to fill out so we can take a look and see what's going on. And then there's a 20 or 25-minute consultation with the patient, to evaluate them, their lifestyle, their physicality.
They're bringing in their MRIs or anything they've gotten so far?
Sometimes they do. They bring in MRI reports. It's not necessary because I've been doing this 8 years and have seen thousands of patients. And we know the protocols, what to do for the conditions. Sometimes it makes the patient feel better if we'll look at the MRI, but we don't diagnose at Pain Free Life Centers. We just treat pain. And, we give you the first treatment's absolutely free. And I'll tell you, probably 95% of the patients will feel something after their first treatment. The treatment is painless. It's kind of soothing, actually. A lot of our patients, most of the back patients, they fall asleep. We see after the first treatment how the body responds to the laser. And then we tailor a protocol and a therapy program to each patient on an individual basis. So no two patients are the same.
And you talked about how relaxing it may very well be. And again, it's non-invasive, but the movement is going back and forth as well in the designated area. If we zero in, for example, on a lower back, how is the laser being applied?
Well, like for someone in Karen's condition, we would place the laser. It's a handheld wand, and it has to be constantly moved. So we would move it between the L4 and L5, maybe S1 regions of the lower back, because the laser is way too powerful to hold it static. So there are a lot of these places have lasers where the doctor will come in, he'll set it up like an X-ray machine, press the timer for 20 minutes, and walk out of the room. Well, our laser and our formula is so successful and so strong that if I didn't move that laser wand 1 to 3 inches per second, you couldn't even count to 10. power equals depth with a laser. So we would just treat that area, the L4, L5, with a slow motion back and forth, and the patient just feels some soothing warmth. There's no pain. There's no injections. There's no recovery. People leave and they go to work.
Almost looks like an ultrasound device, doesn't it?
Yeah, it does. It's got a roller ball on the end of it. We don't use any liquids or any type of gliding material. We want the laser to penetrate right through the skin to the cellular level.
All right. Jeff Morton's in the studio, the chief laserologist at the Pain Free Life Center. They're out in Troy. Their number is 248-879-1100. We've got Karen and Marshall in the studio. They are experiencing, and we haven't found out for sure what kind of impact this laser therapy has gone through. We'll check that out. But I do want to get to one of our incoming callers, too, because they've been waiting patiently in Allen Park. Jim, come in. You're on News Talk 760. WJR. What about your specific problem that you wanted to get some answers to from Jeff on this Tuesday evening?
Hi, Warren. How are you?
Great, Jim. But I'm guessing you're not so great.
Well, hi, Dr. Jeff. How are you?
Good. How are you?
I'm fine. About 4 or 5 weeks ago, I took a 3-point tumble off my brother's back porch, hit my left kneecap, thoroughly bruised between the knee and the hip. In fact, I drive transportation, and I literally had to take both hands, pulling my pant leg up and helping, because I had to get in and out of a car a dozen times because of what I do in the medical field. Long story short, it finally healed enough where I could at least have the muscle movement back in the leg. But my situation is, because I'm in a vehicle for so long, it literally has telescoped from the leg into the lower back, where that is just so stiff because of the injury and because of my driving. And this sounds, quite frankly, your television or your radio commercials have described this as the Star Trek, if you will. And I believe in the laser, and I'd like to come in and,
Have you tried anything else since? By the way, have you done anything to try and relieve or eliminate?
Hot showers, basically.
Yeah.
I don't believe I want to take pills. I don't want to take any of that.
Yeah. So Jim, what's probably has happened to you, everybody is born with a natural gait, the way we walk. And when we have a trauma in the lower part of our body will naturally adjust our gait to help alleviate the strain of the area that's in pain. So your lower back problem is probably caused by you changing your gait with the way your knee injury was and the contusions that you had. Like I treat a lot of athletes, professional, from high school to professional athletes, that have the same type of issue, and it helps the body heal 40 to 50% quicker. But what we want to do is we want to get you into the Troy Center and take a look at you and get you onto a program so we can help your back. So go to the website, which is painfreelifecenters.com. And
mark that down. Did you mark that down, Jim?
Well, your call screener gave me the number 248-879-1100.
Yep. Yes, that'll work too.
Yeah, I'll give you a call. What time do you open in the morning?
We're there at 8 a.m.
Okay, perfect. I'll give you a call.
All right, good luck, Jim. Thanks for
Jim.
calling in. And you can, too, talk to Jeff. And if you've got a pain, a member of your family, like the couple we have in our studio, someone in your family is experiencing that, and the life-altering experience is not positive, 1-800-859-0957. If you have a pain, someone you know has a pain, give us a ring. We'll put you in touch with Jeff Morton, who's the chief laserologist at the Pain Free Life Centers of Michigan. Warren Pierce here on WJR. We'll be back with some more of your calls, and we'll come back and find out how Karen has done since she started going through the experience over there at the Pain Free Life Centers. First, though, a word or two from our sponsors here on JR at 731.
It's Great Places of the Great Lakes with Warren Pierce, presented by Pain Free Life Centers of Michigan, located in Troy. Once again, here's Warren.
And certainly we're doing our best to help those of you out who have pain. Ways to reduce the pain, reduce the inflammation, reduce the swelling, and help accelerate the tissue repair and regrow or certainly help the cells that have not been doing so well and improving the nerve function. How can all this be happening with just the use of a laser? That's what Jeff Morton is talking about. He's the chief laserologist at the Pain-Free Life Centers of Michigan. He's in the studio tonight. And for those of you who do have pain, like a couple we have here in the studio, ring us up and we'll try and help you out with bursitis or neuropathy or maybe some scar tissue pain. Perhaps you're taking some drugs, prescription, over the counter, maybe Aleve or Motrin, something like that. Or perhaps have been told that you need a back operation. Maybe you already had one or operation somewhere else to relieve the pain that you have been experiencing. Maybe you're using, injections. Stop all that stuff. And don't do anything else until you talk with Jeff. And the phone number to call, 1-800-859-0957. Whatever your pain or someone you know who's experiencing the pain, ring us up there and we'll put you on the line with Jeff as we talk with Karen and Marshall. Jeff, you brought them in. Certainly, Karen, you were talking a little while ago about the pain you were experiencing, the disc arthritis problem, the sciatic nerve creating a lot of pain, and your husband Marshall having to go through life together, not being able to do the things that I would assume you were accustomed to doing before this pain came on. What was life like before and after?
Well, before I could barely walk. The pain was so bad, I just wanted to end it, end the life, and I couldn't function. I have grandchildren that I watch a couple days a week, and that was hard to do. I wasn't able to do that fully. So when we found this, the Pain-Free Life Centers, when we called and went in, first time I'm thinking, oh no, it's not, I don't know if this is going to work. But what we experienced, we were talking about a little earlier, that kind of ultrasound device, it's non-invasive, and it is almost, because I've gone through it as well, almost kind of relaxing, because there's a warmth that comes through as the laser is doing its job on the area that was causing you pain. Exactly, it was. And, you could feel it. It was so soothing, just laying there, being able to not feel the pain while I was doing this. It was very good. And then once the pain started going away for good, I'm walking, standing, sitting, laying on the ground, rolling with my grandchildren, picking them up. I'm able to do all that again. And I owe it all to Jeff and his Pain-Free Life Centers.
How many, by the way, Jeff, experiences and visits do you have to go through before you get results like this? 1, 10, 20? How do you determine how many visits someone should be coming?
Well, Warren, it depends on the condition that they come in with, and a lot of it is if their height, weight proportionate, if they're physically active, their age has something to do with it, their gender has something to do with it, and most importantly, their DNA, because every single patient responds differently to the laser. So there are basic protocols that we use, and for someone in Karen's condition, between 20 and 30 treatments is protocol, but she started feeling results long before then. And I've had patients that didn't feel any results till the 21st, 22nd treatment, and I've had people that were totally pain-free after the first one. However, because we're creating a healing process in the body, it's important that you treat this like a prescription and you finish. Because we are allowing the body to heal, and that takes time. Anytime the body goes through a physiological change, it goes through a 3-step process, and that takes time. You don't lose 50 pounds overnight, and you're not going to heal your pain overnight either.
By the way, how can this one device and the use of laser, which is different from a lot of other lasers out there, how can it be effective from head to toe and anywhere in between?
The simple fact is, Warren, is human cells respond to light And our laser is able to get the light to the cell to give it the energy that it needs to get healthy. Healthy cells create healthy tissue. Healthy tissue increases blood flow. When you increase the blood flow, you reduce the inflammation, and inflammation causes 90% of the pain that our bodies feel.
And it's what shall I say? Accelerating the production of you probably know ATP. I use the initials.
Yep, it's adenosine triphosphate. It helps the body produce fibroblasts and collagen that are enzymes and proteins that are absolutely essential for our tissue to heal. And the older we get, listen, the less we produce, and we're still active. We're way more active at our ages today, way longer into our lifetime than our grandparents or even our parents were, and our bodies haven't caught up. And so this is what the laser allows. It allows the body to catch up.
All right. If you've got a pain, you know someone who does, feel free to ring us up, and maybe we can help you out before this night is out. 1-800-859-0957 in Waterford. Rick, you've been waiting a while. Go ahead. You're on News Talk 760 WJR with Jeff Morton, who's the chief laserologist at the Pain Free Life Centers. And make sure you turn your radio down here before you ask a question because you get very confused. But go ahead, Rick. You're on the air.
Yeah, the radio's off. I've got two questions. One, I've got a young lady. She's probably 57 or 58. She's got arthritis pretty bad. She's had both her hips replaced, and the arthritis is getting into her knees now. She may need to have her knees replaced. And also she has back pain. Now, here's the thing. She's on disability, and she has, I don't know, it's Medicare or Medicaid. I'm not sure how that all works out, but a very limited income. And I'm wondering if this is cost-effective to a person who, would be in that type of a financial situation.
And how would you go about treating the symptoms that Rick was just talking about there as well, Jeff?
Well, the symptoms that he's talking about we treat every day. That isn't an issue. We would have her come in for a consultation. Unfortunately, in the state of Michigan, the government doesn't recognize any type of laser therapy as an insurable modality.
Okay, so it's a cash thing.
It is, but Rick, I want you to tell you that we normally will not let money get in the way of treating our patients as long as we can work something out. And Marshall is here, who was very skeptical when he brought Karen in, and you can ask him what he thinks about whether it's worth it or not for the results that they got.
Well, I'm sure that it would be worth it. I'm just wondering if I can afford it. I'm a lower middle class kind of guy.
Yeah, well, we treat UPS drivers, we treat mail people, we treat policemen, construction workers. I mean, for God's sakes, I have a propeller repairman that comes in. His thumb in hand is crazy.
And that first visit, by the way, Jeff?
Yeah, it's free.
So
right, but it sounds like it takes more than one visit.
Oh, it does. It's a healing process. Yeah. So, if your relative or whoever has arthritis, it depends on what type of arthritis. I mean, I've treated many people with different types of arthritis, but listen, I can't put a value on your quality of life. I would never do that.
I do understand that. Yeah, that I understand. I just wonder, if it's out of my price range because it's actually would fall on me, my responsibility to.
Well, why don't you check it out? Take down the either the phone number or the website as well, and the first visit is free, and go and get more information about what Jeff and his office can do for you. Mark this down, painfreelifecenters.com. But the phone number, you got a pencil there handy too?
Actually, no, I'm racing down I-75 at about 80 miles an hour.
No, don't do that. We don't want you getting a ticket as a result. But just Pain Free Life Centers.
No, I remember the website, yeah.
All right, good.
Hey,
good
Rick,
luck.
Rick, come see it.
I've got one other question.
You do? All right, very quickly.
Yeah, real fast.
The music's going to run out here. Go ahead.
I lost a finger, so I've got
phantom pain. Yep, phantom pain.
Huh.
Yep.
Jeff knew about that.
Yeah, we treat that for sure.
All right, you'll do that too.
Yeah, it's a nerve condition. We can retrain the nerve.
As Ernie Harwell used to say, Jeff, 2 for the price of 1 over there right? At the Pain Free Life Centers. They're out in Troy. The phone number there, 248-879-1100. Back with more about somehow, some way, reducing or eliminating the pain that causes pain in your life. 1-800-859-0957, our number. Whatever pain you're having or someone in your family is experiencing, that's the number to call. We'll put you on the line with Jeff. And we're back after these words from our sponsors here on WJR at 14 minutes before 8 p.m.
Welcome back as Warren Pierce discusses the path to a pain-free life with Jeff Morton, Director of Pain-Free Life Centers of Michigan. Without drugs, without surgery, and without side effects, laser pain therapy is a revolution in pain management. Once again, here's Warren Pierce.
And Mark, we should add to FDA cleared this laser therapy program, reducing the swelling, the inflammation, as you were saying a little while ago, Jeff, promotes healing without surgery and really no side effects. And one of our listeners, a couple of months ago, was hearing you talking about the use of your laser out there in Troy and said, I don't know, Glenn Lashbrook is in our studio. What were you concerned about when you heard Jeff on the air? And you knew you were in pain and you were looking for some relief or elimination. What did you make of what he had to say back then?
Well, I was sitting on the porch, listening to it, hopeful, like everything I've went through. Shots, MRIs, I've done everything for about 4 years. 4 years ago, they recommended surgery, which I did not want to do.
What were the symptoms? How was it caused?
It affected my hips very much, so I could not stand or I could not walk. So within this 4-year period, my sister recommended a wheelchair. I ended up getting a little scooter to go to car shows and stuff, which I didn't want to do it, but I couldn't even walk to them.
Yeah, I've seen those in the supermarkets.
Yes, sir. Well, I could put it in my car and go to the car show and everything. And so I listened to it, and I told my wife, she was sitting there with me, and I said, I don't know, what do you think? And she goes, well, it ain't going to work. And I go, I feel the same way. I said, but what the heck? I'm going to call, make an appointment. I'm going to do it. So I went there, got one treatment, and I don't know how long it lasted.
Probably
maybe
about 20, 25 minutes.
About that.
Jeff, because usually the sessions aren't longer than 20, maybe 25 max, right?
Yeah, Glenn had ruptured discs and arthritis. He had a pinched nerve. And I gave him a therapeutic treatment. It was 20 minutes for his treatment. We do a consultation.
Yep.
So
that's free for our listeners. That's free. The first session is free. Keep that in mind too.
Yeah. So the first session and consultation's free. The first treatment's free. And I got to tell you, Glenn was incredibly skeptic.
You were driving a truck for 40 years, Glenn?
About 40 years.
Did that cause the problems?
Yes, sir. That ruined vertebrae in my back.
Why? Because the bumps that you would go over?
Just the back and forth and the movement and the position that you're in. Well, about 5 years ago, I had to retire. That's how bad I was getting. And then, like I said, I went. Surgery was my
doctor prescribed
choice.
that?
Yeah, they said, and chances are we could help you. Mm-hmm. Well, I just wasn't going to do it.
You were already, did they schedule you for surgery?
Okay, getting to that point, I wasn't going to do it. Mm-hmm. I sat on my porch. It's no quality of life. And I told my wife, I said, I'm going to go to the Cleveland Clinic. I see these on the TV and everything, like I seen everything else.
Yep.
And, they'll do this little cut, and you'll walk out and be a happy guy.
Right.
So I'm thinking, okay. So I'm sitting here listening to your show.
Right.
And it comes on, and I'm thinking, I'm going to try it, because I'll tell you what, I didn't want the surgery. I did not want it, but I was at the point I didn't care. And it was the best thing I ever listened to. I mean, WR, you do got a great show.
Right, I appreciate that.
But it was the best thing. All my friends can't believe how I'm walking within 2 months.
Were you taking over-the-counter drugs to try and eliminate this pain?
Yes, sir.
Did they prescribe any drugs for you?
Yes. I was taking pain pills. I took like Aleve.
And by the way, Jeff Morton, we've talked about Aleve and ibuprofen, I guess. And if you're taking a lot of that trying to eliminate the pain, it can do what? Horrible things to your stomach.
Oh, Warren, I have a patient, 58 years old, had complete bowel reconstruction from over-the-counter medications. And he was dealing with chronic back problem, and he was taking Excedrin and Aleve and ibuprofen. And at 58, had to have complete bowel reconstruction. The medications are terrible for you.
So you're trying those, Glenn Lashbrook, over-the-counter prescription drugs. What about the injections? There are medical professionals who suggest, look, we're going to try and help you out by injecting you with...
Yes, sir.
What is the stuff they inject them with, Jeff?
Well, it's cortisone, which is 60% lidocaine, so it's a numbing agent. Because if we were to inject pure cortisone into you, the body would go into shock from the pain of the injection itself. You know, lidocaine, it numbs it down. It's a neurotransmitter blocker that blocks the nerve signal of pain to the brain. So it's just a mask of the pain. It doesn't do anything to help the body heal. And that's why our patients get such great results, because what we do allows the body to heal as best as it can. And, you know, they're going to happen. You're going to fall into a bucket. Most of our patients, between 52 and 94% reduction in pain is what's going to happen. You know, some people get 100, some people get 30, but for average, it's between 52 and 94%. And let me tell you something. When someone comes in and they're rocking a level 8 or level 9 pain, and I can get them to a 4 or a 5, they're thankful. It's like a new day, a new beginning for them.
What was it, Glenn Lashbrook, that you didn't want the surgery? What had you heard, read, or seen that you were so reluctant to go down there to that Cleveland clinic?
Well,
they're famed.
It doesn't always work.
Yep.
Now, I had a friend of mine just had it done, a month or so ago, and he thought he was paralyzed. He was so scared, and he's still in therapy. I had mine, and I'm walking, doing things.
Yeah.
Yes. Now, he is doing a little better. But, I mean, I just didn't want – I was just scared to death, because do you want to be paralyzed? I'm sitting in the chair on the porch thinking, you know, it couldn't be worse. Well, it really could be.
Well, and you've got this pinched nerve in your hips. You're thinking you're never going to walk again. And even the pain was more severe when you were standing up. You go to see Jeff and out there in Troy, and after one session on a scale of 1 to 10, what did you go down to? Do you feel at the pain-free life centers?
Well, if you can imagine what a 10 is, everybody measures pain different.
Yeah,
I was severe pain when I got off that table. Maybe a 4. Well, Jeff seen the expression on my face. I couldn't believe it, because like I said, I went in there thinking it isn't going to work. And when I got off that table, I just can't describe how I feel.
What about future then sessions over there at the Pain-Free Life Centers of Michigan?
I'm thinking like maybe I got 30. I'm thinking I'm probably around 21, 22. And I'm walking. I'm doing so much more. I had to put a chair in my shower because I could not stand long enough because of pressure on my back. I couldn't go to the bathroom hardly. I couldn't brush my teeth. I had a quality of life that was terrible.
All right, Glenn, hang on. And we want to hear from you listeners out there, those of you who are experiencing pain like Glenn or some other area of the body. And we're talking about dealing with pain from head to toe. You may have migraine headaches that you're trying to deal with, or plantar fasciitis, or carpal tunnel syndrome for those of you who are in the office working on tennis elbow, maybe some injuries related to playing sports. No matter what the pain that you're experiencing, give Jeff a call right now. Toll free, 1-800-859-0957, and talk with Jeff. Let's see how he can help you out, or someone you know, maybe a member of the family, or somebody you work with. And don't forget, the operators are standing by, the wellness coordinators at the Pain-Free Life Centers, accepting appointments by phone right now. The first one, the consultation, the session is absolutely free. And we'll pass out that number right now as we wait for your incoming calls, too, at 1-800-859-0957.
If you'd like to see how laser pain therapy can change your life, call Pain Free Life Centers now to schedule your initial no-cost consultation and free treatment. Wellness coordinators are standing by now to take your call at 248-879-1100. You have nothing to lose but your pain. Once again, that's Pain Free Life Centers at 248-879-1100 or visit painfreelifecenters.com. We'll be right back with Warren Pierce and Jeff Morton, Director of Pain Free Life Centers, on News Talk 760 WJR. Welcome back as Warren Pierce discusses the path to a pain-free life with Jeff Morton, Director of Pain Free Life Centers of Michigan. Without drugs, without surgery, and without side effects, laser pain therapy is a revolution in pain management. Once again, here's Warren Pierce.
And we're talking Achilles tendonitis, arthritic pain, bursitis, spinal conditions, shin splints, plantar fasciitis, rotator cuff injuries. Oh, I hear a lot of the pitchers, don't they have those, Jeff? The rotator cuff injury, wherever that is, that's got to be somewhere in the shoulder.
It's in the shoulder, Warren. Yeah, we see a lot of athletes with rotator cuff injuries and hockey players with plantar fasciitis and Achilles tendonitis.
And let's not forget about Dave Roseman. He'd be very upset if we didn't mention his name, because he's got to be one of your athletes that has been with you the longest time from the Detroit Tigers, formerly. And he's still pitching, down there at Comerica on certain Saturdays. Yep. They have events where there's Roseman out there on the mound, despite the, 4 or 5 knee surgeries he had?
Well, he did, and he had 4 or 5 knee surgeries before he came to us. And his prognosis was he needed a knee replacement, but it was in April, and he didn't want to rehab over the summer. So we treated him and got rid of his pain for almost 18 months. He had his knee replaced, and we treated him after his knee replacement because of scar tissue. We do a lot of post-surgery stuff.
All right, we better get to our incoming calls. And if you have a question about a pain you have personally, someone in your family, ring Jeff up at 1-800-859-0957. Mike's been waiting patiently in Linden. Go ahead, Mike. You're on News Talk 760 WJR. What is or was your pain? What were you experiencing?
Well, I broke my ankle when I was 13 years old, and it was a bad break, and it was okay until about 10 years ago, and then it developed arthritis in it. And I was playing hockey at the time, and I had to quit playing hockey because the pain was too much. And I've been taking a leave, and I don't like taking a leave. I don't like taking pain pills, but anyway, I heard about this treatment on WJR and called and went there, and I've had 6 treatments so far, and on a 1 to 10 scale, probably the pain is between a half and 1.
Wow.
All day long.
Are you ready for the Super Bowl? Sounds like you're ready for the Super Bowl again.
Well,
just like Jared Allen for the Carolina Panthers, who had the same condition. We mentioned that a little while ago, 2 weeks before the Super Bowl game. Breaks his ankle, like you. And lo and behold, like you, they used laser on him, and he was playing in the game.
Well, I play softball in Florida, and if I can get to first base, they can put a runner in for me, because I can't run the bases. But I'm hoping this year that maybe I'll be able to run the bases. I mean, it's almost like a miracle. It's hard to explain how you can feel so bad, and then they put a light on you, and it's healing it. I don't have any of the inflammation anymore. I used to have a lot of water on my ankle, and there's none there now. And it disappeared pretty much after the first treatment.
Well, and as you pointed out, Jeff, a little while ago when we began, it's a scientific fact that human cells respond to light, which in turn then promotes healing of the cellular level. And I'm sure there's some listeners out there who may have been under the impression that once a cell dies, whether it's in your brain or your body somewhere else, it's gone. You've lost it.
No, that's not true. Actually, cell has memory, and that's why it takes so long for auto accident victims to get soft tissue healing, and the laser will help that about by 65% heal quicker. Mike drives down from Linden, which is not a short drive, and all I can tell you is that he's a typical patient at Pain-Free Life Centers. And, Mike, you're there and you see patients in the waiting room, and what is the usual attitude of everybody?
I'm sure they're happy they're there.
Yeah.
And you know what else as a bonus? You get a bottle of water. Do you get? Is Jeff giving you a bottle of water when you leave?
Yes, they offer it, and I've taken it 3 times.
Yeah.
Well, wait. It's important to hydrate, right?
Yeah. Well, the reason we give water, it doesn't have anything to do with the condition. What is, we find that most of the patients that we deal with, they don't hydrate enough. They don't drink enough water. And so what we do is we give them a bottle of water, and it kind of trains them to drinking water because healthy tissue and hydration, they go hand in hand.
All right, continued success there, Mike, in Linden as we head over the Detroit River into Windsor. Al standing by with a particular problem that you wanted to mention to Jeff to see how they could maybe eliminate or reduce the pain. What was yours, Al?
Okay. Hi, Jeff. First of all, I have type 2 diabetes.
Okay.
Both feet tingle.
Yep.
Front to back. Left knee, I had arthroscopic surgery. Removed the meniscus, bone fragments, whatnot. I've had cortisone shots, but apparently you're against the cortisone shots, right?
Well, they do damage to the body, Al. It frays the tissue, and it can create parastasis in the bone, which makes the bones brittle. That's why they don't give cortisone shots the way they used to in the 60s. They'd give a football player, a hockey player, an athlete a cortisone shot every week, and what the medical world has found that it does damage, and it's a neurotransmitter blocker. So, your bigger problem for me is not your knee. I mean, that we can take care of the arthritis, but you're diabetic, so you have what's called peripheral neuropathy, and it's going to get worse. And your feet they'll tingle, they'll get numb, they'll become burning. You won't be able to feel your feet underneath you. As you get older, you'll start to lose balance. And we can eliminate all of that with the laser. Your doctor will put you on Lyrica, Neurontin, Cymbalta, gabapentin, and those medications don't do anything for the condition that you have. The laser therapy will allow the myelin sheath to grow back over the nerve root and actually allow the neuropathy to go away. But the key, yes, 100%. That is the second most common condition that we treat is diabetic neuropathy. But the key is about this, Alan, and I treat a lot of your countrymen. They come over. I got brothers that come over as far south as London, but a lot of people from Windsor, they come across 2 to 3 times a week to get the treatments for many different conditions. The key about neuropathy is getting in front of it before it starts to ascend up your leg to your knee. The pain in your knee, that's easy to get rid of, but the neuropathy is going to take some time. And my suggestion to you is, and I got my wellness coordinator standing by at the office. The girls are working overtime, so I want to give them a shout out to Tiffany, Tammy, Carrie, Alyssa, and you guys are doing a great job. And I'm sure they're slammed busy because when I do these shows and I educate people about the alternative modality to the drugs and the injections, we just blow up.
All right, so get your phone call. Make your appointment right now. Again, the first consultation is free. The first session is free. But as Jeff is mentioning, the appointments do fill up. So call this number, 248-879-1100, or you can go to the painfreelifecenters.com website as well. But either one of those, make sure you're getting in to see Jeff, especially for the first time. And you can call him directly now, too, 1-800-859-0957. He's in the studios here at WJR to answer any question you may have, someone in your family may have, someone you know. You watch them try to go through day-to-day activities, and it's so difficult going to the supermarket, having maybe to lean on the shopping cart while they're going up and down the aisles. It can be so disruptive to your life. Losing sleep, you name it. So give them a call, 1-800-859-0957. Very quickly, Glenn, before we take a break, and Glenn didn't think he was even going to be able to walk again after being a truck driver for 40 years. Pain was so severe, sitting on his porch listening to Jeff talking about this a couple of months or so ago, goes in for one session, and the pain gets reduced. Prior to that, Glenn, and you were talking about suggesting or they were scheduling you for surgery in a hospital down in Cleveland at the clinic there. How much money were you spending trying to reduce or eliminate the pain that you were going through?
I couldn't count it. My insurance has a deductible. I was going twice a week, getting 6 shots, 3 on each side of my spine. And it wasn't working. They suggested going right in my spine. Wasn't working. Went back to the pain clinic. They suggest, well, it's either going to be surgery or we could try the shots again. There's no sense in trying something that doesn't work. And like I was saying, the surgery was next, which I was regretting tremendous. And I went into Jeff and never thought about the surgery again.
And that's why he says you make pain-free life centers your first choice, not going through all these things here bordering on surgery, and not your last resort. The number for Jeff is 1-800-859-0957. We'll begin to close out our Tuesday evening after we pause here on News Talk 760 WJR.
If you'd like to see how laser pain therapy can change your life, call Pain Free Life Centers now to schedule your initial no-cost consultation and free treatment. Wellness coordinators are standing by now to take your call at 248-879-1100. You have nothing to lose but your pain. Once again, that's Pain Free Life Centers at 248-879-1100 or visit painfreelifecenters.com. We'll be right back with Warren Pierce and Jeff Morton, Director of Pain Free Life Centers, on News Talk 760 WJR. Welcome back as Warren Pierce discusses the path to a pain-free life with Jeff Morton, Director of Pain Free Life Centers of Michigan. Without drugs, without surgery, and without side effects, laser pain therapy is a revolution in pain management. Once again, here's Warren Pierce.
And we're talking about an estimated 100 million Americans suffering from chronic pain. And when this pain is persistent, and Glenn Lashbrook, you don't need me to tell you about this. Even daily activities, driving a car, sitting at a desk, going to the supermarket, can become daunting or even impossible tasks. The most common solution, prescribed painkillers, and they can have a devastating consequence, varying from dependency, and Jeff Morton, you've been talking about that, to addiction, from this increased pain to overdose. So let's, if we can, get quickly to a caller who's been waiting on our direct phone line, 1-800-859-0957, for a while. Here in Detroit, John, what was your particular pain that you wanted to share with Jeff Morton?
I wanted to find out, I heard him talking about how that soft tissue responds to the light, and I have a torn rotator cuff. They talked about surgery. I've done the physical therapy, et cetera, and so forth. I wondered if, and I work every day, actually.
You work at a kennel?
No, I work every day.
It sounds like the dog's barking in the background.
No, I'm driving.
Oh,
Sorry,
okay.
Driving.
All right.
So, I wondered if you've had experience with rotator cuffs as far as the light therapy.
I do, John. We treat it regularly. Actually, one of my patients had a 1.5-inch tear in their labrum, and it healed without surgery.
Really?
It'll help the tissue heal faster. I just had a world-class weightlifter come in this week, and we're treating his shoulder. I've had professional athletes come in with rotator cuff injuries, and we take care of them. It's a process, and the fact that you work and you probably use your arms.
I do.
And it'll take a little bit longer for you, but it'll work, and you'll be able to avoid surgery. I have a patient who works at the Shelby engine plant. It's a lady who she doesn't weigh 112 pounds, and she puts cylinder heads on the Shelby engines and uses the big gun to do it. And so her shoulders and her elbows are just trashed, and she's gotten great results. It's taken a little longer than someone who doesn't do that kind of work. But yes, call the office, make an appointment, and come in and see me.
I'll do that.
All right, very good.
All
Great,
right.
thanks for the call.
All right, thanks for checking it. Don't that sound like dogs barking at the
It
background?
was wind. Yeah, it was wind.
I
noise.
know. It sounded like some sort of kennel. And again, Jeff, let's point out before we close off, you are so confident in what you all do there. You're going to give a free treatment, a free consultation, but the key is to call as we speak, line up an appointment, because every time you're on with us, once a month or so, a lot of folks call the folks who you mentioned a little while ago, the wellness coordinators, taking down names, answering some questions too,
Yep.
and setting up appointments for
Yeah,
you.
yeah, and they should do that and call in 248-879-1100, and one of the girls will take care of you and get you in, because we book up fast. I mean, we have a waiting list, so you need to call and get in.
And what do you, as we close out here, Glenn Lashbrook, someone who was pretty much convinced you'd never walk again, you had arthritis in your back, pinched nerves in your hips, and most of the pain was when you were standing up. What message would you leave with those who are in a similar situation or experiencing pain and somehow, some way want it reduced or eliminated?
Well, it changed my quality of life. And the thing I'd like to stress, you can make the decision. You go there, get your free treatment, you make the decision. There was no pressure, there was nothing. It was the best move I've ever made in my life.
Mm-hmm.
I'm back to bowling. I'm starting to golf again. I even walk my dog. I mean, it doesn't sound like much when you do it every day. But when you can't do it, it's such a joy.
And Warren, this was a guy that 2 months ago couldn't walk to his mailbox. I mean, literally couldn't walk to his mailbox. And, I appreciate Glenn coming down. He's not getting paid for this. He offered to come down, and because Glenn, you want to help the listeners do what?
I want them to be pain-free. And I have a lot of friends, and they're all amazed. There's not one person that hasn't commented on the quality of life that I have today. And like I said, it's only your time.
It's safe. The lasers are the highest quality and strongest. Won't hurt, right? You're promising that.
Yeah, there's no pain at all. Actually,
No.
most of our patients fall asleep during their treatments.
And how many treatments will they need? They got to come and see you and find out, right?
Yeah, we put together a specialized professional therapy program for each individual patient on an individual basis.
Call right now, all right, 248-879-1100, or you can go online to painfreelifecenters.com and get that free treatment right away. As usual, thanks to Jeff, and we've got the news coming up next.